Guys, what's new today?
Nothing new, I guess. Aini, how about you?
Have you guys ever heard about epilepsy? What is epilepsy?
Yes, I have heard about it. And based on my research, epilepsy is a common chronic neurological disorder that characterized by recurrent, unprovoked seizure. This seizure is also caused by a sudden burst of excess electrical activity in the brain, and it causes a temporary disruption to the brain. And this disruption result in the brain messages become halted or messed up.
Wow, that was an interesting explanation. But I wonder, how does epilepsy occur in our body?
Before I go into that part, let me explain first about brief anatomy of the epilepsy. This epilepsy commonly associated with anatomical changes in hippocampus, amygdala, frontal cortex, temporal cortex, and also olfactory cortex. As for epilepsy, we divide it into two: generalized seizure and focal or partial seizure. And focal seizure means it only affects one part of the brain. Thus, it includes idiopathic location-related epilepsy (ILRE), which is either at frontal lobe, temporal lobe, parietal lobe, or occipital lobe. While generalized seizure affected both of hemispheres of the brain at the same time. Thus, it includes absent, tonic, clonic, myoclonic, tonic-clonic, and febrile seizures. Thus, we have come to the part of the pathophysiology, or we call it how the epilepsy is actually occur. Thus, let's view a video that will make us understand it much better.
During a seizure, clusters of neurons in the brain become temporarily impaired and start sending out a ton of excitatory signals over and over again. And these are sometimes said to be paroxysmal. These paroxysmal electrical discharges are thought to happen due to either too much excitation or too little inhibition, which are kind of two sides of the same coin, right? The main excitatory neurotransmitter in the brain is glutamate, and NMDA is the primary receptor that responds to glutamate by opening ion channels that let calcium in, a positive ion that tells the cell to send signals. Some patients with epilepsy seem to have fast or long-lasting activation of these receptors. On the flip side, the main inhibitory neurotransmitter in the brain is GABA, which binds to GABA receptors that tell the cell to inhibit the signal by opening channels that let in chloride ions, which are negative ions that tell the cell to inhibit signals. Some patients with epilepsy seem to have genetic mutations in which their GABA receptors are dysfunctional, and so they aren't able to inhibit signals. In addition to potentially having a primary genetic cause, though, these receptors and ion channels might be affected by all sorts of things like brain tumors, brain injury, or infection.
How is it? Is it understandable? As per its definition, seizure occur when nerve cells in the brain send excessive, sudden, and uncontrolled electrical signals. Remember, focal seizure only affected a part of the brain. Thus, it may lead to simple focal seizure, which is we remain conscious, or complex focal seizure, which impair our consciousness. As for generalized seizure, I will explain it one by one. For myoclonic, it happens with brief arrhythmic jerking motor movement that lasts less than 1 second and often cluster within a few minutes. While clonic is a rhythmic jerking motor movement with or without impairment of consciousness involving the upper and lower extremities. While for tonic is sudden onset tonic extension or flexion of the head, trunk, and or extremities for 7 seconds, often associated with other neurological abnormalities. While for atonic, which is drop attack, it happens with sudden loss of muscle tone and the person falls to the ground. It may last a few seconds. And the last one is tonic-clonic seizure. It happens with tonic phase, so muscle contract, body stiffen, and the person falls to the ground. And then we move to the clonic phase, consists of short, rhythmic jerks and gradually slow down. And then the muscle relax. And the last one is post-ictal state. It may come after the tonic-clonic seizures and it may last from minutes to days. If the seizure lasts more than 5 minutes, it is usually tonic-clonic seizure. Najwa, can you tell us the risk factor for epilepsy?
Yes, sure, Huda. There are several risk factors for epilepsy. The first one is age. The onset of epilepsy is most common in children and older adults, but the condition can occur at any age. The second one is family history. If you have a family history of epilepsy, you may be at increased risk of developing a seizure. Third is head injuries. Head injuries are responsible for some cases of epilepsy. The next one is stroke and other vascular disease. Stroke and other blood vessel disease can lead to brain damage that may trigger epilepsy. Next is dementia. Dementia can increase the risk of epilepsy in older adults. Sixth is brain infections. Infections such as meningitis, which causes inflammation in your brain or the spinal cord, can increase the risk of epilepsy. Lastly, seizures in childhood. High fevers in childhood can sometimes be associated with seizures. Children who have seizures due to high fevers generally won't develop epilepsy. The risk of epilepsy increases if a child has a long fever-associated seizure, another nervous system condition, or a family history of epilepsy. So, do you get it now, Huda?
I get it now. But can you share with us what is the sign and symptom for someone who have epilepsy?
Generally, seizure signs and symptoms may include temporary confusion, a staring spell, which is common in absent seizure, stiff muscles, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, and lastly, psychological symptoms such as fear, anxiety, or deja vu. Because epilepsy is caused by abnormal activity in the brain, seizures can affect any process your brain coordinates. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Just like Huda explained just now, there are two classifications of seizures, which are generalized seizures and focal seizures. Signs and symptoms for generalized seizures are the person may look blank and stare, lasting for a few seconds, and they might appear to be daydreaming or dazed. The eyelid fluttering and blinking may occur. They may have minor facial movements or head drop, and most generalized seizures typically last between 1 to 3 minutes, and they are able to continue normal activity almost immediately afterwards.
This is an example of atonic seizures, which is one of the generalized seizure. Here, we can see the person loss of muscle tone and falls to the ground. It occurs very rapid and can last a few seconds.
During a focal seizure, sometimes the person knows what is happening and is somewhat aware of his or her surroundings. They may be able to describe what happened, and some things that may happen with this type of seizure are jerking of the arms or legs on one side of the body, tingling or other unusual feeling on one side of the body, turning of the head or eyes to one side, and a fearful or pained look on the person's face.
This is an example of focal or partial seizures. Here we can see the person has jerked on his right side of the body.
So, do you guys understand now?
Thus, after knowing the clinical presentation of epilepsy, how can we diagnose it, Najwa?
There is no single test that will diagnose someone who having an epilepsy or not. A diagnosis is based on the medical history and eyewitness account of the event. Various other tests such as an electroencephalogram, EEG, MRI, blood and genetic testing may help to identify the type of epilepsy and possible cause. Electroencephalogram, EEG, is one of the main diagnostic tests for epilepsy. It detects electrical activity in the brain using the electrodes. An EEG is a safe and painless test that looks for changes in your brain's electrical patterns that relate to seizures. Some abnormal patterns may occur with many different conditions, not just seizures. This is an example of EEG of a person with epilepsy and without epilepsy. Here, we can see the differences between the electrical activity in someone who has seizures and not having a seizures.
Because of the generalized seizures affect the whole brain, so the brain electrical activity spike the same in both halves of the brain, while partial seizure only occur in one part of the brain, so the spikes between the halves is different to each other.
Aini, can you tell us the treatment and management for epilepsy?
Thank you, Wawa, for the question. Okay, so for the treatment of epilepsy include first, anti-epileptic drugs or known as AEDs. It is usually used to control epilepsy but not to cure epilepsy. And it is usually taken twice a day, and the common side effect of this medicine includes tiredness, dizziness, and nausea. The second management of controlling epilepsy includes ketogenic diet. So what is ketogenic diet? It is a special high-fat, low-carbohydrate diet that helps to control seizures in some people with epilepsy. And this diet usually recommended by the doctor for children whose seizures have not responded to several different seizures medication. However, this diet has its side effect that might occur if the person stays on the diet for a long time, such as kidney stones, high cholesterol levels in the blood, constipation, slowed growth, and bone fracture. The third treatment is vagal nerve stimulator, which prevent seizure by sending regular pulses of electrical energy to the brain via the vagus nerve. The last treatment of controlling epilepsy includes surgery and devices, and this will be considered if the anti-seizure medication don't control your seizure and if your seizure is severe. And the surgery option include surgical resection, such as removal of abnormal tissue. Second, disconnection, such as cutting fiber bundles that connect areas of your brain. Third, stereotactic radiosurgery that targeted destruction of abnormal brain tissue. And how does this device work? They work by sending electrical impulses to your brain to reduce seizure over time.
I'm curious, what are the complications for the individual who already have the epilepsy?
So, what is the complication of individual who already have epilepsy? People with epilepsy may experience health problems other than seizures. There is an increase the likelihood of experiencing first other neurological problems such as precipitating migraine. Second, it interferes with your cognitive problem. Cognition such as memory can be affected due to epilepsy. And in some cases, epilepsy causes developmental delay or regression. And third, it also can interfere with your sleep, which may cause sleep disturbance. Fourth, it also has medication side effect. Seizure during pregnancy pose dangers to both mother and baby. And certain anti-epileptic medication increase the risk of birth defect. And fourth, seizures have complication which may lead to injury and death. Because for epilepsy patient, there is a small risk of an unexplained death in epilepsy, or known as SUDEP, when epilepsy is purely controlled.
Okay, now I get it. So what is the Islamization behind the epilepsy? Can you tell us?
Sure, there is a verse in the Al-Quran which means, and He alone heals me when I am sick. So from this verse, we have to always remember that Allah is the one who restores our health with all of His mercy, and don't forget to stay close to Him anytime, either we are sick or not, so that our epileptic will become euphoric. That is all from us. Thank you for watching.